As the holiday season approaches, the world faces the spread of a new COVID-19 variant. Dr. Mustafa Hirji, Niagara's acting medical officer of health, joins us. Dr. Hirji, what kind of threat does the Omicron variant hold for us this December?
So, Mike, I think the unfortunate thing is that we don't yet know, which is, I think, what's creating a lot of the angst right now, because we can't say for certain what the threat of this is. There is some evidence that it is spreading more easily than the Delta variant, so it may be more difficult to control. There's not really good information, though, on whether it's going to be more severe. There's no real good information of how well the vaccine is going to work against it. So we kind of feel we're going to deal with something a little bit unknown here. What worries us is when we look at this variant, it has a lot of mutations. And the mutations are ones that might confer it ability to spread more quickly, might give it the ability to evade the vaccine, might make it more severe. But we just don't know if that's actually going to pan out in real life. And it's going to be a few more weeks, I think, until we really know what we're dealing with.
Some countries are beginning to close their borders to travel from certain other countries. Is this something you feel that Canada will need to do sooner or later?
You know, I'm not sure closing the border is really the best approach here. That, really implies that we are sure that the virus is in this country or this set of countries. And so if we close off our border to those countries, we're going to keep it out. I don't think we've seen border controls have entirely worked because people can travel from that country to somewhere else and then come here. It also implies that the virus is there, and we're increasingly finding it's not there. We're finding it across Africa. We're finding it across Europe. It's been found in Asia. It's been actually found even here in Canada in some returning travelers. And I really worry it's probably in the United States where the situation with COVID-19 is out of control and they just don't have the quality of surveillance to actually detect it. And, unless we're willing to close our borders off to every country, I don't think border closures are going to work. Instead, what I'd recommend is that we require anybody who travels into Canada gets a test a few days after they arrive back. That way we can make sure that they didn't pick up infection and develop infection, as soon as they arrived here. And then if they did develop infection, we can actually send that off for genetic sequencing and figure out what actually is this virus and is it one of these variants or not.
Switching gears a bit, this week we began vaccinating children age 5 to 11. Has that been taken up well?
It's definitely been taken up well over the first few days. We've been really heartened to see all of our clinics full. And even more than that, we're receiving really great feedback for all the things that we've done to make these clinics really child-friendly. I actually received an email the other day from a parent who was saying that their child went through the clinic and is actually happy and excited afterwards, which is such great news because, of course, this makes sure that they're going to come back in 8 weeks to get that second dose. We are seeing the highest risk of COVID-19 right now in that 5 to 11 age group, who has only just been able to become vaccinated, so hasn't been vaccinated yet, but is in school, is in extracurriculars, is in sports, is having lots of interaction with other people, and so that puts them at a lot of risk. And I think if everybody can sign up to get a dose of vaccine for their child before the Christmas holidays, that's going to make them a lot safer as we go through the holiday season.
Some people in Niagara of the higher end of the age group are receiving their booster shots. When will that start trickling down?
So the booster doses have already been happening. We started doing booster doses, at the start of the month of November. Many people are only, I think, becoming eligible for their boosters, though, in the next few weeks. In public health clinics, temporarily, we're pausing on doing boosters to really focus on delivering vaccinations to that 5 to 11 age group who has not yet had the opportunity for any protection yet, and they have the highest risk of COVID-19 right now. And then once we see we've got through the children, we're going to move back to doing booster doses for everybody who is eligible for boosters. Pharmacies, primary care are currently also doing boosters right now, so there's lots of opportunity as people become eligible for boosters in the coming weeks.
Dr. Hirji, last question, really quickly. Christmas holiday season approaching, wearing masks, physical distancing, that's going to be important this month.
Absolutely. We are seeing cases go up here in Ontario. We are seeing cases go up very sharply across the border in the US, in Europe, around the world. We have the threat of the Omicron variant now as well. We want to make sure we double down on everything that has actually kept things relatively good here and is actually going to enable us to have a relatively more normal Christmas season this year. So we will be able to have family gatherings. I recommend you limit those family gatherings to people who are fully vaccinated so that you keep them as safe as possible. But if we do that and with everybody else, we continue wearing masks, we keep our physical distance, we continue being cautious, we can hopefully get through this Christmas season, really enjoying everybody's company again, but making sure we don't see a big spike of infections coming out of it.
Dr. Hirji, once again, thank you for joining The Source.
You're very welcome.